Hello, my name is Ashley Gardner, and I'm the Director of the Federal Emergency Management Agency, or FEMA. The U.S. Food and Drug Administration, or the FDA, and the Centers for Disease Control and Prevention, or the CDC, has issued an alert to those who received influenza vaccines from October 1st through December 15th in the following 21 states: Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. Thousands of reports have been made to the CDC regarding a mystery disease. The mystery disease has been traced back to a batch of mutated vaccines that was mixed with other batches and then distributed by a vaccine facility that services Northeast and Midwest regions in the U.S. Half of the vaccines have been found to mutate when contacted with the body's T cells. The illness caused by the vaccine is not contagious. Influenza vaccines were available to the public from October 1st through December 15th. Initial illness has been reported in 9 states: Maine, New Hampshire, Ohio, Kansas, Minnesota, North Dakota, South Dakota, Indiana, and Iowa. As of today, 2,435,627 people across 5 states, including Ohio, Maine, Minnesota, Iowa, and Indiana, are reported sick with symptoms. 256,987 of those patients reported sick also had paralysis, and 54,267 cases of paralysis has resulted in death. If you received an influenza vaccine within the last 30 days and are experiencing vomiting, diarrhea, high fever, and headache, contact your healthcare provider immediately or go to your hospital's local emergency department to seek medical attention. Reports of paralysis and death have occurred within 3 to 5 days of the onset of symptoms. The National Childhood Vaccine Injury Act requires that all healthcare professionals report to the Vaccine Adverse Event Reporting System, or VAERS, when a patient contacts them about adverse reactions to vaccines. Patients affected should be prepared to give healthcare providers the following information: the type of vaccine received, the timing of the vaccine, the onset of the adverse event, current illness or medication, past history of adverse events following a vaccination, demographic information about the recipient. As of right now, the Department of Homeland Security has not yet ruled out bioterrorism at this time. The National Incident Management System, or NIMS, is monitoring the cases and working closely with the CDC and the FDA. The Vaccine Adverse Event Reporting System will be used to track and monitor those affected by the mutated influenza vaccines and those with symptoms. 15.75% of the vaccines were given to individuals in the population, and the remaining 25% has been recalled and on its way back to the CDC for analysis. Once the analysis is finished, the vaccines will be destroyed. There is no counteractive drug available, but the CDC is working to find an antidotal drug. More information will be available when the remaining vaccines are analyzed, which are to arrive tomorrow morning. A follow-up announcement will be made tomorrow evening. FEMA and the CDC are working together and will address any questions or concerns. You can call FEMA at 1-800-621-FEMA or email us at www.fema.gov. You can also contact the CDC at 1-800-CDC-INFO.